Hello everyone, myself Adarsh Yadav, second year B Pharmacy. I'm studying in Shivajirao as Jondhale College of Pharmacy, Asangao. The topic which we are going to cover in this video is Beta-adrenergic blockers, medicinal chemistry, guided by Dr. Nitin C. Mohire, who is professor and principal of our college. So let's start. Beta-adrenergic blockers. These are the drugs which block the beta receptors and antagonize the effect produced by beta neurotransmitters. Examples are propranolol, carvedilol, esmolol. These beta-adrenergic blockers are classified into three types: beta 1 selective, beta 2 selective, and non-selective. Let's see what their characteristics are. Beta 1 selective. Beta 1 selective are cardioselective beta blockers. They mainly act on beta 1 receptors, and beta 1 receptors are mainly present in heart. So they are mostly used in treatment of hypertension. Beta 2 selective. Beta 2 receptors are present in lungs and bronchial muscles. So beta 2 blockers cause contraction of bronchial muscles. Non-selective beta blockers. These type of beta blockers act on both beta 1 and beta 2 receptors. We are going to study SAR, that is structure activity relationship of beta blockers. In the top right corner there is a diagram of propranolol. So we are using it as an example. In this diagram we see that the structure is divided into three parts, that is aromatic ring, a carbon chain, and an amino group. Let's see what aromatic ring does. Most of the derivatives have substituted phenyl ring in place of naphthyl ring. If alkenyl and alkenyl oxy group are present in ortho position on phenyl ring, it will give good beta antagonist activity. Addition of OH group in phenyl ring leads to removal of antagonist activity. If phenyl ring is replaced by naphthyl or substituted by naphthyl, then they become non-selective beta blockers. Carbon chain. The OCH2 group is placed between aromatic rings and ethanol amino side chain, increases activity. If there is H group present in place of OCH2 group, then it becomes non-selective. Amino group. If isopropyl and T-butyl groups are present on amino group, then it provides nucleophilicity to amino group. Example: timolol and etinolol. We are going to study some drugs with beta blockers. The first drug is propranolol. It is non-selective beta blocker and white in color. Let's see its mechanism. It works in two steps. Step 1 is decrease of renin release, which leads to step 2, that is reduced cardiac output. Its uses. It is used in treatment of hypertension. It is also used in treatment of cardiac arrhythmia, that is irregular heartbeat. Synthesis of propranolol. Step 1. Alpha naphthol is treated with epichlorohydrin in presence of base KOH, and an intermediate is formed. Step 2. The intermediate formed is then treated with isopropylamine, which gives propranolol. The next drug we are going to study is Metibrinol. It is a white crystalline powder insoluble in water. It must be stored in well closed container. Mechanism. It is a non-selective beta blocker. Uses. It is used in eye drops in treatment of glaucoma. Etinolol. Its mechanism. Etinolol is beta 1 selective antagonist. Its uses. It is used as antihypertensive. It is also used in emergency treatment of cardiac arrhythmia. The next drug is Betazolol. Its mechanism: it is beta 1 selective blocker. It is used as antihypertensive. It is also used in treatment of glaucoma. Bisoprolol. Bisoprolol is beta 1 selective. It is used as antihypertensive. It is also used in treatment of heart disease. Next drug is Esmolol. Esmolol is also a beta 1 blocker. It is short acting antihypertensive. It is used in early treatment of myocardial infarction. Metoprolol. Metoprolol is beta 1 selective blocker. It is used orally in treatment of hypertension. It is helpful in treatment of heart failure. Labitolol. Labitolol is non-selective beta blocker. It acts as a competitive blocker on both alpha 1 and beta receptor. It is orally used as antihypertensive agent. It is given intravenously during severe hypertension. Carvedilol mechanism: it is non-selective beta blocker and acts on alpha 1 and beta blocker. Due to alpha 1 bondage, it relaxes blood vessels and lowers the blood pressure. Its uses: it is antihypertensive drug. It is helpful in congestive heart failure. We are thankful for our President Honorable Dr. Shivajirao S. Jondhale, Secretary Honorable Dr. Geeta Khare, Principal Dr. Nitin C. Mohire for encouraging us to make informative videos and proper use of social media to spread information. For more informative videos, please like and subscribe the channel. Thank you.